Recording in progress.
All right, all right. Well, hello, everybody. I am Dr. Darlene Allen Nichols, and I am excited to share this presentation with you today. And I am a coach for academic coaching for world changers, and I coach on the NCMHCE. So if you are looking to study for that, this video is going to help you, give you a few key things that you will need to know as we go forward. So let me just start and I'll tell you what we're going to be talking about today. Today, we're going to talk about MDD versus PDD. All right. So before we get into that, just want to remind you that if you want to book a session, please feel free to book a session with me, Dr. Darlene, ACWC at gmail.com. You can also go to our website, Academic Coaching for World Changers, or you can send an email to Dr. Pam 2020 and we at gmail.com, and we will be happy to set up a meeting for you so you can pass this test. I know you can, and then you will. So we're going to talk about something that often shows up or has shown up on the exam. So I want to just share with you some information on PDD versus MDD. MDD is major depressive disorder versus PDD, which is persistent depressive disorder. This information is based upon the criteria from the DSM-5, which you know is our Bible as we are studying to pass this test. So let's get right into it. And then we're going to do some practice questions at the end just to ensure that you know it. But I want to tell you, you got this. Take your time. You can do it. Let's get right into it. All right. So when we look at major depressive disorder and persistent depressive disorder, they are both mood disorders. And sometimes it gets a little tricky because there's a few variances and the symptoms are going to differ in severity, duration, and then according to the diagnostic criteria for the DSM-5. So you may get some questions around MDD versus PDD, and you really need to know the DSM-5 definition and the symptoms that occur with both. Both of them are depressive disorders, all right? Both of them are a mood disorder. One is different than the other. So look at the key symptoms. Let's talk about the key symptoms first of both of the disorders. So when you look at MDD, MDD is major depressive disorder, and it's going to present with a depressed mood for at least 2 weeks. Your client has been depressed and they've had anhedonia, they've had significant changes in their appetite, insomnia or hypersomnia, can't sleep, psychomotor agitation that other people can notice, fatigue, loss of energy, feelings of worthlessness, or excessive guilt, diminished ability to think or concentrate, or indecisiveness, and even recurring thoughts of death or suicidal ideation, or even a suicide attempt. If these symptoms have lasted for 2 weeks on a consistent basis, these symptoms, then you're looking more than likely at MDD, which is that major depressive disorder. Major depressive disorder, the symptoms will last 2 weeks at best. 2 weeks at best. And you see the symptoms there. They will last at least 2 weeks. Now, when you look at PDD, persistent depressive disorder, the same symptoms, or a little bit more, are going to last for 2 years, at least 2 years. MDD 2 weeks, PDD 2 years. Okay, that's a big difference. Almost about the same symptoms: anhedonia, poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration, feelings of hopelessness. But this has lasted for 2 years. Okay, the key differences are: for MDD, it's 2 weeks. For PDD, it's 2 years. Okay, so please make sure that you know that. Now, again, here we go, saying the same thing again. For MDD, those symptoms will last at least 2 weeks. For PDD, they will last at least 2 years. These are the key differences between the two, because they can get tricky. You may get a question on there about someone who has been struggling with one symptom for 2 years. One symptom is just anhedonia. Well, they don't have enough symptoms to qualify them for PDD. But if they had some other symptoms added on to those symptoms, and it's been 2 years, then yeah, PDD. Severity. MDD is more severe and episodic. So you'll have episodes of MDD, whereas PDD is chronic and less intense. This is just their normal way. This becomes their normal trait, their normal way. PDD, persistent. It just persists. It keeps going. It keeps going. With the functional impact, MDD will cause significant impairment. So if you have that major depressive disorder, you are really, really low. You're having those symptoms consistently for 2 weeks. You're having the symptoms over and over again. You're low, you're suicidal, you're hopeless, you don't feel like you can make it. You have excessive, you sleep, maybe some sleep apnea going on, or sleep issues going on where you can't sleep, or fragmented sleep and things like that. You don't want to eat, or you're overeating. With MDD, significant impairment is happening. Whereas with PDD, it causes an ongoing low mood. Have you ever seen somebody that they're always sad? They're always sad. They're always low. They're always struggling. That has become their mood, okay? It's an ongoing low mood. Now listen, there can be a co-occurrence where MDD can occur during PDD, and that's what's known as double depression. So you can have the MDD, just that major depressive disorder, okay, is happening in the middle of your PDD. You already have PDD, but then you go down really, really, really low for 2 weeks, and it's in the middle of PDD, and that's known as double depression, okay? So let's look at some practice questions. All right, now this is for the NCMHCE exam. If you are studying for this exam, these questions are going to help you, or designed to kind of help you know a little bit about the way the DSM-5 sees MDD versus PDD. All right, major depressive disorder and then persistent depressive disorder. Major depressive disorder, don't forget, 2 weeks. Persistent depressive disorder, 2 years. 2 weeks for MDD, 2 years for PDD. All right. I'm going to put the question up. I'll read it. I'll put the answers. We're going to take a break and pause. You can think about the answers. Think about what you feel the best answer is, and then I will show you the answer. Okay. So here's our first question. The vignette is Carla. She's age 32. She reports feeling down most days for the past 2 years. She describes low energy, poor self-esteem, and hopelessness. She denies any history of manic or hypomanic episodes. Which diagnosis best fits Carla's presentation according to the DSM-5? Remember, the DSM-5 is your Bible as you're getting ready to take this test. 1, major depressive disorder. Persistent depressive disorder, cyclothmic disorder, adjustment disorder with depressed mood. All right, I'm going to take a pause, think about it, and then you decide on what the best answer is. Remember, I'm going to take 2 answers away that do not, definitely, they're not there. They're not it. Take those 2 away, and then you're going to work with the last 2 and pick the best answer. Okay? Okay. All right, let's look at the answer for Carla. The answer is B, persistent depressive disorder. Rationale, 2 years. Remember, PDD is 2 years. And chronic mild depressive symptoms. Mild depressive symptoms equal PDD for 2 years. All right? Remember, MDD is more severe, but PDD is chronic and it's mild. So the answer is persistent depressive disorder. And if that's what you said, which I know you did, you got it right. You are getting ready. You're going to pass this test. Okay. Here's the next question. Here's the vignette. James, a 25-year-old graduate student, reports loss of interest in activities, insomnia, poor concentration, and feelings of worthlessness for the past 3 weeks. What is the minimum duration for diagnosing major depressive disorder? A, 1 week. B, 2 weeks. C, 1 month. Or D, 6 months. All right, I'll take a pause. Think about it. Pull out the 2 that you know are not the answer. Ponder on the last 2 and pick the best answer. Okay, you ready? All right, let's hit it. B, the answer is B, 2 weeks. Rationale, don't forget. The DSM-5 requires symptoms lasting at least 2 weeks for MDD. 2 weeks is your key factor. And you hear 2 weeks and you start hearing these symptoms, these depressive symptoms, it's MDD. Okay? 2 weeks. Very good. If you answered B, you are on the road to passing and getting your full licensure. All right, here's the next one. Tanya reports longstanding sadness since her teenage years, but says it comes and goes in intensity. Recently, her symptoms have worsened to include suicidal thoughts. What is the most accurate description of Tanya's current situation? A, recurrent MDD. B, PDD with current MDD episode or double depression. C, bipolar 2. Or D, adjustment disorder. Look at the 4 answers. Pick the 2 that you know do not belong, and then ponder on the remaining 2 and pick the best answer of those 2. Okay, I will pause and you go. Okay, are you ready? What is the most accurate description of Tanya's current situation? B, PDD with current MDD episode. If you answered B, you did it right. Yes, because don't forget, PDD can persist chronically and worsen into an MDD episode, and that's known as double depression. Because they've got the PDD, which is chronic, that's just their low mood. That's how they always are. But then in the middle of that, they go lower, all right, with the depression, and it lasts for 2 weeks, and that's called double depression. It's an MDD episode in the midst of a PDD or PDD diagnosis, okay? Very good. I know you got it right. I know you did. I know you did. You're well on your way to passing this test and becoming fully licensed. All right, and here we go. A 41-year-old client reports feeling mildly depressed for years, but continues to work and care for her children despite low motivation. Which statement best describes the likely level of functional impairment? A, severe with inability to maintain work. B, moderate with some impairment. C, mild functioning despite symptoms. Or D, none. All right, pick the best answer. I want you to think about MDD, PDD. Think about everything we've discussed. Look at the 4 answers, pull out the 2 you know are not the right ones, and then pick the best out of the 2 remaining. I'll pause, and then I'll give you the answer. Okay, you ready? You can pause it if you can pause your video if you still are thinking. But I'm ready to go on to your answer. All right, let's go. The answer is mild functioning despite symptoms. So PDD, remember this is their state. It often allows partial functioning despite chronic low mood. Okay, don't forget that. You can still function, you just have a low mood. That's PDD. It's been with you 2 years or better. Okay. All right. I hope that you've enjoyed that. I want you to book me for some sessions if you would like to do that. Here are a few coupon codes. We've got 4 sessions. We've got our boot camp. We've also got the NCE course, but I actually tutor or do coaching on the NCMHCE course. So if you are looking to get fully licensed, sign up, use one of the codes, and I'll be more than happy to assist with getting you to passing your license. Okay. More information about booking sessions, you can go to drpam2020@gmail.com. Subscribe to our channel. We've got several YouTube clips up that you want to see. They're going to help you in passing this exam. It's in you. The information is there. You can do it. You can do it. You will do it. Okay. All right. And check out our website for any group. We got group that we may have a group coming up on this topic. So go to Academic Coaching for WorldChangers.com and check out what we have. If you would like to reach out to me personally, you definitely can. And my email is drdarleneacwc@gmail.com. I'd love to help you pass the test. You've got it already on the inside of you. I know you can. All right. And I'll be more than happy to help you pass. Thank you so much. I look forward to hearing the good news that you passed and you are fully licensed. Have